Hi everyone, today I'm going to talk to you a little bit about myofascial dry needling. So myofascial dry needling, or MDN, or just dry needling, it is a technique that I use a lot. Probably around 70% of my clients I think I would use it on, but that is by and large because I have quite an active population group that I work with. It's a really effective technique for reducing active and latent trigger points, for getting rid of what people might call knots, or reducing the amount of tightness and discomfort and pain around knots. It's a really specific technique. So if your usual massage techniques aren't working to actually alleviate that tension and that discomfort around that area, dry needling can be a really, really effective tool. So it also has a number of other effects on the body that are really, really useful. So it has a bunch of effects on the nervous system, so it gives really good access to the nervous system in terms of trying to alleviate dysfunction and get access to changing how an area is functioning. So it works really, really well in that space. So it is something that I use quite a lot. And I'm just going to demonstrate a little bit so that you guys can actually see what it is like to be dry needled. So first thing, I'm just going to use my forearm. So I'm going to just prop it into a nice comfortable position. So what we're using the same tools that acupuncturists use. They are acupuncture needles, but we are not acupuncturists. I am not an acupuncturist. I am a remedial massage therapist or soft tissue therapist, and I use dry needling as one of the tools under that banner. Okay, so I'm just getting a couple of needles out, one at a time. I have already swabbed the area using an alcohol wipe. Okay, so keeping up the hygiene protocols here. All right, so relaxing your forearm onto that towel. I'm actually going to palpate around, and I'm going to find an area of tension in my extensor muscles here for my forearm, and I can feel a nice juicy trigger point right there. Okay, and so pop the needle on, tap it in, not particularly painful. I get a really nice deep ache in through that area, and I get a nice referral pain. So it's trigger point referral pain down toward my wrist, quite strong. I play around with that. Oh, could you see that twitch? And I can actually, with these type of needles, they grab really well within the connective tissue. So I can actually twist that needle and it will create really good micro stretch within the tissue. I can, to make sure that I've actually got the right muscle, I can actually apply a little bit of movement, and I will see, or you will see, that the needle actually moves. I'm going to bring my arm a little bit closer and do that again so you can see. Okay, and that winds up the technique, so that actually feels quite uncomfortable. And you can see a bit of tenting around that tissue, around that needle now. See that tissue popping up? So it means that that needle has got really, really good grab into that connective tissue there. Okay, so I'm just going to relax for a little while. And one of the things I notice is my hands have just gone quite clammy. It's a really common side effect with needling. You get a lot of engagement of your sympathetic nervous system sometimes. So your autonomic nervous system is really strongly affected by dry needling, or it can be. Everyone's different with how they respond. So it's really important that if you're seeing a therapist for the first time with this sort of technique, that they are very aware that they can very easily overdose you in terms of your nervous system response. So you can get a little bit clammy through your hands and your feet. You feel a little bit nauseous. You feel a little bit faint sometimes. So it's really important that they're really only putting a couple of needles in, and they're really mindful of just staying in communication with you as a client, making sure that you're okay. All right, so what I'm doing now is I'm just waiting for the tension to drop out in that needle. So it's getting close to me being able to pull that needle out, because I can feel that that deep ache that I had, and I can see that the tissue, the amount of tightness in the tissue is just diminished. I could go searching for another trigger point if I really wanted to, but for the purposes of this demonstration, I think that'll probably do. So there you have it, myofascial dry needling, no more niggles.